SAP IS-HT interview questions and answers. What is SAP IS-HT? SAP IS-HT, Industry Solution for Healthcare, Hospitals, is an industry-specific solution built on SAP ERP to support the operational, clinical, and administrative needs of hospitals and healthcare organizations. It integrates patient management, billing, and clinical processes. What are the key components of SAP IS-HT? 1. Patient management, PM. 2. Patient accounting, PA. 3. Clinical workstation, CWS. 4. Medical documentation. 5. Integration with SAP FI, Colorado, SD, and HR. How does patient management work in SAP IS-HT? Patient management handles the registration, admission, transfer, discharge, ADT, and scheduling of patients. It acts as the backbone for all patient-related administrative processes. Explain the ADT process in SAP IS-HT. 1. Admission. Register a patient and assign a case ID. 2. Discharge. Mark the completion of treatment and generate discharge summary. 3. Transfer. Move patient from one ward department to another. What is a case in SAP IS-HT? A case represents a single episode of care or visit for a patient. It is a central element that connects administrative and clinical processes. What is the difference between EHR and EMR in SAP IS-HT context? 1. EMR, Electronic Medical Record, digital version of patient charts for individual departments. 2. EHR, Electronic Health Record, comprehensive health data accessible across different departments and providers. How is billing handled in SAP IS-HT? Billing is performed through the patient accounting module, integrating with SAP SD and FI. It includes creation of invoices, tracking payments, and managing insurance claims. How do you integrate SAP IS-HT with external systems? Using SAP NetWeaver PI, PO, HL7 interfaces, or IDOC, BAPI mechanisms to exchange data with systems like LE, PACS, or third-party EMR platforms. What is the role of HL7 in SAP IS-HT? HL7, Health Level 7, is a standard for exchanging healthcare information electronically, commonly used for communication between SAP IS-HT and external clinical systems. What is a movement type in patient management? It denotes specific changes in patient status such as admission, discharge, or internal transfer. Each movement is recorded and impacts bed management and billing. How do you configure movement types? Use transaction NWP1 to define movement types and configure parameters like case type, movement reason, and movement category. Explain the process of inpatient billing. After discharge, services rendered are posted against the patient's case, and invoices are generated using SAP SD billing functions. Insurance handling is also integrated. What is a clinical order in IS-HT? A clinical order refers to requests for diagnostic tests, medications, or treatments made through the clinical workstation or CPOE system. What is the role of the clinical workstation, CWS? CWS provides a user interface for doctors and nurses to access patient information, medical records, lab results, and documentation. How do you manage outpatient versus inpatient processes? 1. Outpatient. Short-term cases, often without overnight stay. Managed with quick registration and billing. 2. Inpatient. Extended treatment with full ADT cycle and detailed resource tracking. What are DRGs and how are they used in IS-HT? DRG, Diagnosis Related Group, is used for classifying hospital cases for billing and reimbursement. SAP IS-HT supports integration with DRG grouping software. How is resource planning done in IS-HT? Modules like IS-HMED are integration with SAP PP for scheduling of surgeries, staff allocation, and equipment usage. How do you handle insurance companies in SAP IS-HT? Insurance companies are maintained as business partners. Contracts and coverage are linked to patient cases for automatic billing and claim processing. What is the use of NWB1 and NP30 transactions? 1. NWB1. Used for patient master data maintenance. 2. NP30. Admission of inpatient or outpatient cases. What reports are commonly used in IS-HT? 1. Bed occupancy reports. 2. Patient admission, discharge lists. 3. Billing and outstanding reports. 4. Clinical documentation summaries.